Hello, everyone, and welcome to the FinDev Gateway webinar, The Role of Savings in Promoting Financial Health. My name is Abby Augusta. I'm an editor for FinDev Gateway, and I'm joined by my colleague, Daniel Contreras, who is supporting us on the technical side for this Zoom webinar. He's available in the chat if you have any audio or connection issues that he could help with. Our series of FinDev webinars allow financial inclusion practitioners like you to share lessons and attend online presentations and discussions delivered by the world's leading financial inclusion experts. And before we get started, I just wanted to share a couple of notes on logistics. All attendees will have their microphones muted automatically. So to ask questions during the webinar, please use the chat box, which is usually located on the right-hand side of your Zoom window. And we invite you to submit your questions at any time during the webinar. We will address them in the Q&A session at the end. And to ensure that your question is seen by the moderator, make sure to select everyone from the drop-down menu when you send in your question. We have over 240 people registered for this webinar. So we may not be able to get to everyone's questions, but we'll share the Savings Learning Lab contact information at the end so you can follow up if your question remains unanswered. And finally, the webinar recording and presentation will be available on FinDev Gateway after the webinar is finished, and we will also email the webinar recording to all participants. So with that, I will hand things over to Diana Dezso from the Savings Learning Lab to introduce today's webinar and our speakers. Diana?
Thank you so much, Abby and Daniel, for hosting us, and welcome everyone to our session. We're so glad that many of you were able to join. I have to confess that we organized this webinar in record time, working across time zones and organizations. So I'm extra happy that we're all here. Please feel free to tell us where you're joining from. You can also drop in a link to your LinkedIn profile in the chat so we can stay connected after this session if you would like. My name is Diana Dezso. I'm an independent consultant in financial and economic inclusion, and I will be moderating today's session in my role as the team leader of the Savings Learning Lab, which is a learning partnership of the MasterCard Foundation implemented by ITAD. And I'm thrilled to be joined by our fantastic speakers today, Rhyne and Neha Kumar. Beth probably doesn't need any introduction to this crowd. She is currently an independent consultant working on financial inclusion and financial health. Most recently, Beth has been the facilitator of the UNCDF Financial Health Working Group. And Beth was also the managing director of the Center for Financial Inclusion at Axion from its founding in 2008 until retiring in 2019. Neha is a program specialist with UNCDF, where she leads portfolio strategy and program implementation for the financial health program, and her sectoral experience spans across financial health, financial inclusion, gender inclusion, MSMEs across South and Southeast Asia, Africa, and North America. So welcome Beth and Neha to this webinar, to be our speakers. And now on the next slide, I would like to share a little bit about what we have planned for you today. After these introductions, we will launch into a conversation with Beth and Neha on, you guessed what, on how savings contribute to financial health based on our recently published paper on this topic. And then we will also discuss learnings from UNCDF's specific interventions that focus on boosting the financial health of gig workers in Asia. We will then have a Q&A session with all of you. So please, as Abby mentioned, post any comments or questions that you may have in the chat as we go along. And I will try to collect all of them and direct them to our panelists during our Q&A session. And with the next slide, I would like to get us started with just a bit short introduction to the Savings Learning Lab. As I mentioned, we are a learning partnership, and as such, we support learning among the MasterCard Foundation's current savings portfolio programs. We do this through synthesis, curation, generation of knowledge, dissemination, everything focused on savings-led financial inclusion. And the two partners in this program are WSBI's Scale to Save initiative and OPM's Savings at the Frontier initiative, implementing savings-led financial inclusion programs across Africa. So coming back to today's topic, as financial health has been receiving increasing traction with key stakeholders, at the Savings Learning Lab, we wanted to investigate a little bit more the link between savings, both formal and informal savings, and key financial health indicators as part of our knowledge generation activities. And for this, we reached out to Beth and felt very lucky when she said, yes, I can help you with that. And with this, I want to, launch into our conversation with the speakers, starting with you, Beth, with my first question and directed to you. What do we mean by financial health, and why is financial health important? Why should we care about it? And Daniel, we can move to the next slide for this.
Thank you, Diana. It's great to be here, and it's great to hear so many old friends who are in the group. I love the watching the chat of where everybody's coming from. And while I was seeing what a global group we have, I was thinking about how one of the things that I always like to say about financial health is that everyone all over the world is continually striving to be financially healthy. It's sort of it's a very core aspect of life, is struggling for financial security, struggling to make ends meet. And so the reason I think financial health is important, and the reason that I've been working on it for the last couple of years, is that it turns attention to whether, to the purpose of financial services, turns your attention to whether people are succeeding in their financial lives. And if financial institutions and those in the financial sector adopt a financial health perspective, it's putting them on the same side as the consumers, because it's asking them to take the point of view of the consumer. What is the consumer trying to accomplish in their life? They're trying to be financially healthy. And one of the things that is necessary in order for really having conversations about financial health and working on it as a concept is to get a clear definition. And we have lots of definitions that are all, most of them really are saying much the same thing, but sometimes conversations get hung up on trying to define what is financial health. And so when the UNCDF Financial Health Working Group started out, one of the first things it did was to try to agree among all the different experts who were working on financial health to a definition. And the first aspect of that definition is that we use the terms, I usually call it financial health, but we use the term financial health and financial well-being and financial wellness essentially as the same thing, interchangeably. And it's the extent to which a person or a family can smoothly manage their current financial obligations and have confidence in their financial future. We think it's helpful to immediately follow the definition by looking at 4 elements of financial health, and breaking financial health down into these 4 elements helps you to begin to dig into the topic and move from a concept to something that has more content and actionable content. So the 4 elements of financial health being day-to-day finances, smoothing your short-term financial transactions and obligations so that you are not caught out, so that you don't have to, for example, not eat for a couple of days because you've not paid your bills. The second is resilience, and certainly this resilience is now highlighted as a result of the pandemic. The capacity to either be prepared for, preferably be prepared for, also to prevent, and finally to weather financial shocks. And financial shocks really includes lots of non-financial shocks that have a financial aspect to them or consequences. Being on track to reach your future goals. These future goals may include education for your children, adequate shelter, starting a business, being comfortable in your old age, or it may be something more mundane like buying a bicycle. And then the final one is one that is a little bit more controversial. Not everybody includes this in their definition of financial health, is a feeling of confidence and being secure and in control of finances. And this turns out to be important. There's some technical issues about measuring financial health where this matters a lot, because people are pretty good about being able to tell you how financially healthy they are, even if what they're telling you is how they feel about their finances. But I think another aspect of that is that one of the reasons we care so much about financial health is that not being financially healthy is a significant source of stress and pain for individuals and families. And so we just want to highlight that financial health is intrinsically important because of its stress reduction aspect. So maybe that's an overly complicated way of looking at it, but if we think about it, it just as it's managing your financial life well in the day-to-day. Well, let me just phrase the way Commonwealth Bank of Australia likes to put it. It's one day, every day, someday, and rainy day. But I didn't get that right. Every day, rainy day, someday. You want your health, your finances to work for you.
Thank you, Beth. And I really like when you mentioned that everyone all over the globe, including all of us, are on this journey of, financial health or striving towards financial health. That really resonated with me. I want to turn the next question to Neha, and we can definitely take the slides off for this. But Neha, would you like to add anything to the definition, or maybe expand how UNCDF is looking at financial health? I know that UNCDF has established a financial health program. Tell us a little bit more about what it does. Why is this a priority for UNCDF? And if you have anything to add to the definition conversation. Thank you, Neha.
Sure. Thank you, Diana. And thanks, Beth, for explaining to everybody what financial health means and kind of setting the stage right for all of us. What we've seen over the past decade, a lot of businesses and agencies have across the world made a lot of progress on the topic of financial inclusion. And there has been not just progress, but some monumental changes in terms of financial inclusion. But an unanswered question that we at UNCDF were grappling with is that we understand that one needs a bank account and one needs a wallet account, but for what? What does that wallet or a bank account really improve someone's well-being? And if it does, then what component of their life is getting improved by having access to these accounts and different kinds of financial services? So this is something that we were trying to answer, and we realized that if we want to ensure that access is translating into improving the lives of people, then it has to be one step ahead of just including people into financial services. And that's where the concept of financial health really kicked in, because this concept really tries to help us understand. So this concept really tries to help us understand if people's life is getting improved or not. And we ensure that this access is translating into people's life. That's basically how the foundations of the financial health program came into being. Some of the key questions that we at the financial health program are looking at are, one, in line with what Beth explained, what are these outcomes of financial health that we need to look at? Security, resilience, freedom, and control is how we define this. And secondly, if we are to decipher how we should go about measuring any of these interventions that we are doing on ground, how do they really contribute to people's financial health or not? And if they are contributing to people's financial health, then what components of their financial health are being impacted by this? So these are two fundamental questions that we at the Financial Health Program are trying to answer. And we do this by investing into partnerships and being on ground, investing into research and evidence building, but at the same time also getting partnerships with the private sector so that we are able to set up interventions and innovations on ground. And by that, I mean that we're able to frame specific problem statements for different geographies and different segments of people, and partner with different kinds of private sector enterprises to try and solve for those problem statements and try and find a solution.
Thank you, Neha, so much. That gives us a really good context of the work and lessons that you will be sharing later in the session. So that's really great. Beth, we can maybe turn to our recently published synthesis report, and Daniel, we can pop back the slide with the questions, because my next question to Beth is really to tell us a little bit more about the paper, what kind of learning questions we set out to answer, and how did we go about answering them, what kind of methodology we used, an analysis framework for the recently published paper.
This paper was a meta study, and I've never done a meta study before, but it was fun to do. And I have to give a shout out to the co-author and really did so much work on the study, and that's Jayshree Venkatesan, and she, I think, is joined. So thank you, Jayshree, and please speak up if there's anything that I say that's not right, or if you want to add anything. So a meta study is a review of existing studies, and the question really was, there's a large body of knowledge about savings. What does it tell us about whether savings contributes to financial health, and whether savings matters for financial health, and if so, what kind of savings? So that's part of the purpose of the research, is to answer that question. And in a sense, you might say, well, duh, savings is just clearly part of financial health, in that if you have money set aside, you are able to manage your short term, you are more prepared for shocks, you are on track to reach goals, and you probably feel better about your finances if you've got a nest egg set aside. So it's almost a no-brainer to say, well, clearly savings contributes to financial health. But so part of the study was to really just examine the hows and whys of that. But the other part of it was to look at the savings research and see what we could say about the research and the way it was conducted, and whether the savings, whether all the financial health topics were well addressed, and whether using a financial health lens helps in terms of the way you might conduct research. And so just a note to tell you what we did. We started with ITAD. Part of this project that Diana is leading has compiled over the years a huge database of research on savings, and that's embodied in the savings evidence map. So we started with that body of research, and then added to that additional studies that were found partly by keyword and phrase searches on Google Scholar, which is a database of research, as well as specific research libraries that would, likely to have relevant work, such as SSRN, the Social Studies, Social Sciences research base, CGAP, and several others. In that process, we identified 110 papers that were reviewed, and then we found that only 39 of the papers, so 110 papers that had research results on the outcomes of savings, and only 39 of those had commentary that could be seen as related to financial health. So that in itself was an interesting finding, that while there is a lot of research on savings, it doesn't necessarily, the outcomes that are described don't necessarily address any of the issues that we just talked about on financial health. And I'll go into that a little bit more, more later.
Which is interesting. Just to say that the evidence map had, I think we have over 350 studies in the map itself. So yeah, that was an interesting finding, which leads me to my next question, Beth. What were some of the main findings based on the learning questions that we had? And, anything surprised you? Anything that really didn't surprise you? Walk us a little bit through the key findings of this meta study.
Yeah, so of course, the main finding is that savings contributes to financial health, and there's a lot of documentation about, especially a lot of documentation about the smoothing of day-to-day finances, the relationship between savings and food security. People who save more more food secure. But it's on, if you look at what we did was look at these studies through the lens of the 4 elements of financial health, and we found a lot of studies on the day-to-day, less explicitly on resilience, and almost none of it addressed long-time goals. So these are areas where the savings literature really wasn't particularly interested, which is sort of surprising that there was less on long-term financial goals. It was mostly on short-term and day-to-day. And I think a lot of that has to do with the limitations of research. It's harder to look at what someone's trying to accomplish over a long period of time, because studies are not long for the most part. So I think there were 2 main surprises. The first one was how few studies considered financial health. And so most of the studies just give an answer to the question, did savings go up? So there's some intervention, you look at it and you want to know whether the savings among the relevant population rose. And there are a lot of reasons why that is the main thing that savings studies do. It's easy to study the balances. It's easy to do a controlled study with a randomized controlled group with that kind of a question. It's also an incredibly relevant for providers and funders. So if the studies are being done to find out whether a program or a particular intervention worked, really what they care about is did the savings increase because we did doorstep delivery of or doorstep collection or whatever open commitment savings programs. So it's relevant for the providers and the funders. And I think there's also, there wasn't a lot of look at the financial health consequences of savings because of the assumption that, of course, savings is beneficial, so you don't really need to look at that. But to me, it was a big gap that the savings research was not necessarily taking the perspective of the client. It was really just assuming if you save more, it's better. And in particular, there was very little ability to say, well, how did you come to save more? You know, is savings, because savings more can be an aspect of becoming more financially healthy, but it can be an aspect of moving money around. And so one needs to understand the source of increased savings and not just measure how much savings increase. So that's one big takeaway from me. The other big takeaway is about savings groups. And, you know, probably at least half of the research that we reviewed was about savings groups. And there, you know, for one thing, the research on savings groups did pay much greater attention, relatively speaking, than research on savings accounts or any form of savings in an account. So the research on savings groups was much more concerned with financial health. So it commented much more on the financial health effects, and in particular on confidence. You know, so many researchers about savings groups want to emphasize empowerment as one of the consequences, or leadership development as a consequence of savings, of being in a savings group. But I think the biggest takeaway for me was that savings groups, that the reason that there were financial health effects noted for savings groups was not necessarily just about savings. It was about participation in the group. And participation in the group, savings allowed for savings, but it also allowed for borrowing when needed. And so one of the key findings, I think, in both places was the importance of savings as a way to secure the ability to borrow in the future. And then the savings groups were also about ability to work together, to start collective enterprises. So I really came to the conclusion that savings groups, that if you think about people's financial lives as a series of decisions, of financial management decision-making over time, savings groups kind of mirrors that process. It allows a person who is in the group to save when they want to, borrow when they need to, work with others, have many kinds of reciprocal relationships that allow for moving money back and forth over time and across different kinds of obligations. And so I came to the conclusion, savings groups are financial health groups, and they need to be promoted, and financial institutions should try to emulate them.
Thank you, Beth. I really like that saying, that savings groups are truly financial health groups. That resonated with me. And I know some of the partners in the Savings Learning Lab, in fact, are focusing on linking savings groups to formal finance, but also just more fundamentally promoting, continuing to promote savings groups. So that was very interesting. Neha, now that we heard some of the findings from literature that didn't set out to use a financial health when they evaluated outcomes of savings, your initiatives, the UNCDF initiatives, explicitly set out to research financial health outcomes. So it would be very interesting to hear more from you, what kind of research questions you look at when you intentionally wanted to study financial health, and why gig workers? Can you tell us a little bit more about the intentions and how you went about this research?
Sure. So in line with our experiments approach that I mentioned earlier, we identified 3 different thematic areas across India, China, and Malaysia. Now, particularly in Malaysia, we were focusing on gig workers because we identified that particularly in that economy, among the B40 segment, gig workers are a big part of that segment, and we wanted to create quantifiable experiments on ground where we could also measure the interventions that we were running. So that's how the gig worker segment became very important to study in Malaysia. What we did here was that we essentially partnered with different kinds of platform players, fintechs, and even government departments, wherein we tried to create different kinds of experiment with each of the partners. Through our initial scoping and feasibility assessments that we did through research, we identified that income volatility is a very big problem for gig workers. And a sudden shock, something like the COVID-19 pandemic, can completely derail their entire financial planning process. So we also did a lot of research, which actually backed what our on-ground insights were. We found that saving for emergencies and retirement planning were major concern among the Malaysian, especially in the bottom 40% or the B40 population. So we could see that savings could be a solution that enables better resilience, particularly when we are talking about shocks. And what we essentially did was that we, through these experiments, we got multiple partners on board. And one such example of a partnership that we set up was with a platform, gig economy platform called GoGet. They essentially have a lot of gig workers in their network. We got another platform called Pod, which is a micro savings platform. Another platform called Sinang, which helps in digital insurance. And also PIDM, which is essentially a government agency which is made to safeguard financial consumer protection. And in one such experiment, we tried to not just create, we tried to create different kinds of financial health products for the people within the app that they were using on GoGet. So the GoGet or the GoGet gig workers, or the go-getters as the organization calls them, they were not only able to find livelihood opportunities, but they could also get access to training modules, financial and digital literacy nudges while they were using the app. And they were also able to do their savings with Pod, which was integrated within this app, and they could just click on a button and save certain amount aside through using just one interface. And similarly, they were also able to access insurance, and eventually through some other partnerships, they were also able to contribute towards EPF, which helped safeguard their long-term retirement plans. So this is just one example of the partnership we stitched. There were several others that we did. And the idea for us was to figure out what we read in theory and what we find through research. Is there a way through different experimentations that we can marry all of that together and see what the outcomes could be?
Thank you, Neha. And what were some of the, I understand that the research involved surveys with these users across these platforms, and I really like the diversity of the platforms you can get to, summary aspects of financial lives, if you will. What were some of the questions that were asked in the survey? How do you get about, how do you go about finding out from those users what is the status of their financial health? What are some of the aspects that you tried to investigate?
Absolutely. So because we didn't want to overcomplicate the concept of financial health for gig economy workers, the questions that we were asking were more around their state of their sense of financial control that they felt, let's say, 2 months ago versus what they were feeling a quarter down after using these products. So we really tried to keep very simple surveys, which the platform was able to run on their platform and the people were able to answer. But essentially, if I talk about the key findings regarding the work that we did in Malaysia, particularly from all of these experimentations. Firstly, we were able to, on an aggregate basis, we were able to reach out to about 300,000 people in Malaysia, which included about 33% women. And our aggregated partner data indicates that the average savings per user and the average saving frequency per user nearly doubled despite having the COVID-19 pandemic while these interventions were going on. We also saw that people were shifting their short-term consumption-related savings towards a more thought-through goal-based emergency fund. So they were able to save into products that were more long-term, like the ETF product that I just mentioned, which also indicates that with the running of the financial and digital literacy at the back of all of these different interventions that we were stitching, people were actually able to improve planning on their part. And if I have to just point out maybe the top three findings that we had, apart from these key stats that I just gave an overview of, the first one would be integrating services at the point of income becomes really important, and it becomes like a positive behavioral anchor. It's different when we ask people to save X amount at the end of the month or end of the quarter or end of the year. People are not able to often do that. So the point where you're generating that income, if you are ensuring that people are able to save certain amount at that point, it becomes easier for people to save, and it also ensures that they are saving regularly and it is not something that's only happening once in a while. The second thing that we realized is that bundling and layering of services and products works better. So just the example that I gave, this is not just one insurance product or one saving product. We kind of bundled everything together, and then foundationally we were helping them understand what all of this means. So over the time that we ran these experiments, we saw that our partners, almost the value of savings increased by 40% between Q1 and Q2 of 2021, which is a massive increase. And this is all aggregated partner data. And even when we speak about insurance, we saw an uptick of about 20%. So these are some of the numbers that really reflect that when you give people something in a bundle, it works better than giving isolated products for them to access. And I think the last or third thing that I would like to mention is also the awareness and literacy campaigns that are being run, and this is happening all over the world. We know so many financial and digital literacy and financial health related trainings happening on ground digitally, all of that. But when we do that just in isolation, it doesn't have that kind of an impact unless and until we integrate that into something where people are able to practically use that knowledge. So in this case, when we were not just giving people a savings product, but we were also telling them about what it means to save. And we were throwing these nudges through the platforms that if you save today, X ringgit, 5 years down the line, it's going to be Y. So when you throw those kind of nudges to people and give them real insights, that works better than just doing trainings and talking about everything in isolation. So I think those were some of the key insights that we had from our experiments in Malaysia.
Thank you, Neha. And your last point really resonates with Beth's comment of looking not just at savings or one financial instrument in isolation. It's really financial lives with saving, borrowing, kind of in tandem during various points in people's lives, and bundling services. It's certainly an interesting idea to try. So thank you for that. Very, very interesting findings. I want to come back to Beth, and I see some questions in the chat. I'm seeing all of them, collecting them. So please continue to post them in the chat. I have a last question for both Beth and Neha before we turn to the Q&A section. So Beth, for you, coming back to our analysis and findings and hearing more about UNCDF's recent work, do you have any recommendations, or what kind of recommendations do you have for the different range of stakeholders currently involved in financial health or who should be involved in financial health?
Yeah, I mean, I think for me, the study that we did was more illuminating about research than it was about provision of services. And in research, I think there are a couple of topics that I mean, one, there's the big overall point of when you're trying to develop research, put a financial lives lens in it, and you'll be asking a more meaningful question than many of the research questions that are asked in the studies that we saw. So try to find out ways to ask these more meaningful questions. The topics that are understudied include resilience and long-term goals. And so it's a bit of a surprise to me to find that was true, but I think overall, I'll look at both of those topics is and how they relate to savings is surprisingly in need of more. For financial service providers, I guess the big takeaway from this particular study is exactly this idea of products that have the range and flexibility of savings groups, not just a standalone credit product, but a product that allows and supports the management of your financial life, which maybe it's bundled, maybe it's just a a credit card in some ways is more flexible than a credit. But any products that allow for the consumer to exert their financial management, both skills and needs, and support that financial management process.
Thank you, Beth. And it sounds like some of the experiments that Neha was describing do just that. So it's encouraging to see some action in that direction. I think it's time for us to turn it over to questions and comments from our participants. And I collected a few that were posted already. And we have a first one on definitions from Carla. And the question is, how should we explicitly include resilience vis-a-vis climate change in the financial health definition? What thoughts do you have about that?
Yeah, I would say that the whole question of climate change and it's obviously a huge question, but when we're trying to understand financial health, we're looking at the financial aspects of any given problem or shock. So the nature of the element of resilience in the financial health definition includes all kinds of shocks, whether it's somebody has a crime, somebody has a major life event, they got divorced, there's a fire that sweeps through the town, any kind of a shock, and we only look at the financial aspects of it. So clearly the whole study of resilience is increasing as an important topic, and it goes way beyond the financial side of things. But I think it's just, if we try to include all of the kinds of shocks that people are looking at in the definition of financial health, it would just be overwhelming. I think what it does, one of the things that financial health as a concept does is to point beyond the financial sector at the causes of lack of financial health, because financial services can only be sort of a helper in the process of being financially healthy, but the causes of the struggle to be financially healthy generally lie outside the financial sector, and climate change would certainly be one of them.
Thank you so much, Beth. I don't know if Neha, you have anything to add to that, but there is one question directed to you, so I'll ask that question if you want to add anything to the climate resilience being added into the definition. The question to you relates to whether regular savings contributions work for gig workers who have volatile incomes and have been impacted adversely during the pandemic, or are these savings instruments structured really flexibly? Do you have any?
Yeah, so I mean, that's a very interesting question. So what we've seen is that when the income is generated, and even if it's a very small percentage of that income being generated is put in aside into a savings account, that definitely works. But another thing that we've realized is that people find it difficult to save into different kinds of products. So let's say there's a separate product for child's education and marriage, which is more aligned to someone's goal, versus retirement and emergency needs. That is very difficult. Asking a gig worker to save into 5 different products when their income generation is very limited becomes difficult. So what the approach that we will, in fact, which has come out of the learning from Malaysia, and we'll be taking this approach into Odisha in India, is that can we have a consolidated saving product, which at the point where you put money into that product bifurcates amounts into long-term, short-term, goal-based savings with stipulations and conditions. And would that be something that creates better effective results for informal workers as well as gig workers? So this is a question that we will be figuring out through our experiments in India, but definitely making sure that people are able to save at the point of income generation was one of the key learnings. We saw that people who were not doing that at the point of income generation often said that they do not have the money to save at the end of the month.
Thank you so much, Neha. And I see in the chat a lot of support. At least a few participants support the idea of savings groups and how savings groups contribute to financial health, and a lot of answers from participants to each other. So I really like that we can do that as well in this session. I'm going to give an example that Carla asked about, an example of where financial institutions who started with a credit-focused initiative, if there are any examples of how they expanded to include a financial health approach, and Marie responded. So that's really interesting. One question for both Beth and Neha, maybe, if you can suggest some specific steps to design financial health compliance products and services. What would be some steps in the design process of these financial services so that they are financial health compliant? I like this idea, financial health compliant, but I guess, to achieve financial health types of outcomes for the customers.
Sure.
Go ahead, Neha, I'll join after.
Sure. So again, something that we're doing in Odisha, where we're working with self-help groups or saving groups, is that we are creating an entire ecosystem, what we're calling the financial services marketplace. Now, what we are doing here is that we're working with financial institutions to create products which are specifically designed for the low-income rural populations of Odisha. The idea here is to not reinvent the wheel. There are so many products already in the market across the globe, but there is a reason why nothing is working. There is a reason why low-income communities are not fully accepting products and services which are technically designed for them. So in that process, we are also going to look at the minimum requirements that should be in a product that kind of certify them to be financially healthy versus products that don't do that. And again, over the next 1 or 2 years, we will be doing a lot of experimentation around that. So I may not have the answer to your question right away, but I think our approach is going to be to come up with matrices and indexes which kind of help us understand what kind of financial services are inclined towards financial health or not. The second point that I would also like to make is that we are also doing a lot of work on mainstreaming financial health. And one of the reasons why financial inclusion took off and even businesses adopted to them was because it added to the top line and bottom lines of businesses. So how do we then ensure that people are accepting financial health as something which becomes organically part of their business? To do that, we are also trying to explore measurement of financial health, and we are creating indexes in certain regions which can then later on contribute to a larger financial health indicator, which again can be incorporated not just for financial service providers, but even in other industries where people can figure out for themselves what the financial health score looks for certain kind of products and services.
Yeah, just to add on to that, you know, a lot of the efforts that have gone into trying to make financial health compliant products, if you want to use that phrase, has been on behavioral economics and putting behavioral economics elements into products. A lot of focus on enabling things such as money management apps. And I'd say, you know, a lot of the work that has explicitly been on financial health has been done in high income countries. And so a lot of it is how to digitize in a way that supports people to have financial health. Now, all of that is all well and good, but I think it tends to miss the point of what is financial health really. If you look at financial health and you take a financial health perspective, what are you really seeing? What you're seeing is that financial services are not the end all and be all. They are supportive. And so one of the key suggestions is for financial service providers to connect with the sectors that have the greatest impact on financial health. And for example, the health sector. So a financially healthy, a financial health compliant product might be one that supports ability to smooth out the costs of healthcare. You have a whole set of financial health things that's related to access to government benefits. So that's one whole area of how financial health can change the thinking of your product design. But I think the core insight from this particular paper is not to segment the products into individual, this product, and you've bought this product only, but making the offer a lot more holistic.
Thank you so much, Beth. And I think we're at the end of our time for questions with participants, but I am truly loving the exchange of messages in the chat from one participant to another, sharing resources. I also shared, somebody asked about concrete outcome measurement frameworks for financial health. So Beth, I shared the Measuring Financial Health paper, the Centuries paper. I think that's probably the most comprehensive one on that. I have one quick final question just to add to what you started to say, Beth, and then Neha. You know, Beth, what do you envision for the future of the financial health movement? And then Neha, to you, you know, what is the next frontier in the practice of financial health?
So, I mean, I think what's going on right now in the financial health movement is a lot of discussion about how to measure financial health and a lot of discussion about how to do, as I was saying earlier, these behaviorally informed products that support financial health. But for me, financial health is not so much a set of specifics. It's a way of looking at the financial sector, looking at the role of the financial sector. One of the, let's see, just there are a couple things floating around here. One is I wanted to go back to the question about the ultra poor. I thought that was a really good question. And I think one of the things that needs to happen in financial health is financial health grew out of the high income countries where people have people can have the aspiration for a financially comfortable life. And so the definitions of financial health are often over the heads of the people in a very low income. And I think an important thing to do, and it's an important research question perhaps, is what does it mean to be financially healthy when your income is low? It doesn't mean full financial health, but even at a very low level of income, there are ways of supporting people to be more financially resilient and less financial or less. And so there is a lot of research or a lot of thinking needed about what can we say as an aspiration for the financial health status of people in low income settings. I just did want to mention one of the things that I'm working with Queen Maxima and UNSGSA, which is on trying to have a bit more global agreement on the method of measuring financial health. And we're calling it vital signs, which is, sort of like you take blood pressure and the temperature, and that gives you an initial quick reading. And we think that the acceptance of one key set of vital signs to measure financial health would be really useful for benchmarking across countries. And so we're working on that right now.
Very interesting, but thank you. Thank you so much. A very concrete example of what we might see coming up from that group. Neha, one quick final comment in terms of what you see next in terms of practice, financial health practice. And maybe Daniel, I can ask you to put the slides back while Neha is sharing her final remarks.
Sure. So I'll make this quick. And I think in line with what Beth just mentioned, in fact, we are working on financial health measurement as well. We are setting up indexes which will turn into indicators to measure concretely what financial health really means. And this can be applied in different industries, including healthcare, financial services, etc. The second priority for us is to, we have now moved from Malaysia and we are setting up a living lab in Orissa, where we're working with the government of Orissa, focused on self-help groups. These would be around 600,000 self-help groups, roughly 7 million women, wherein we are not just we are doing experiments by setting up market linkages, bringing in financial services, and imbibing all of this with very concrete digital and financial literacy programs. And our idea over the next 3 to 4 years is to see how income improvement contributes or doesn't contribute to people's resilience and their control over making financial choices. So this is something that we move on to next.
Thank you so much. Some very interesting initiatives. I want to thank both Beth and Neha for their contributions, really interesting insights, and the hope that we now have in terms of what's coming up for financial health in our sector. I have a slide on the screen with some of the resources we shared in the chat as well, just so you know that these will be available when we share the deck from today with everyone. So don't worry if you cannot click on the links on the screen, but we will send this to everyone who joined. And with that, I want to turn it over to Abby to tell us what's next and to thank everyone for joining us today.
Great. Thank you very much, Diana, Beth, and Neha, and all of the participants for such an engaging discussion. Before we close, I just wanted to go over what's next. As I mentioned in the beginning, the recording from this webinar and the presentations will be shared on the FinDev Gateway website after the webinar. And once the recording is available, we'll send a follow-up email with the recording to all those who registered for the webinar. And please feel free to share this with your network. If you have a question that we didn't have time to answer during today's webinar, and I know there are a lot of them, then feel free to follow up. You can contact Savings Learning Lab at the email that's on the screen. And of course, for more financial inclusion resources, please visit findevgateway.org. And now we'd like to hear from all of you to get your feedback. When you close your Zoom window, a brief survey will appear, and we'd really appreciate if you can please take a brief moment to respond to those survey questions. Once again, a big thank you to the panelists and to all of you who joined the webinar today for your questions and engagement on the topic. Thank you and have a good morning, afternoon, or evening, wherever you are. Thank you, everyone.